There we go. All right. Microphone check. 1, 2, 3, 4. Microphone check. 1, 2, 3. Yeah? Good. All right. Gonna do over on this microphone real quick. Mic- Hissy.
Are you guys ready for a media check? Or a sound check? You ready? 1, 2, 1, 2, 3, 1, 2, 1, 2, sound check. 1, 2, 3, 6, 7, 8, 9, 21, Is everyone else good? Cakes in it. Are you good? Okay. This is going to be the last sound check we'll do. So I just want to make sure everyone's good. His. All right, we'll try to fix it. Thanks, guys.
Hey, Eddie.
to talk about something here?
We're gonna try.
We're sitting next to each other. It's good to have you here. Hi there.
Hey, how are you, Mr. Secretary? Good to see you, boss. Ted Mitchell.
Beginning with the finish of this special session. One thing's gonna happen today. We want to use a bad document. It's like you're on the third grade, it's real hard and line up on the other side of the green. Works often. It's kind of where we are. Well, listen, I want to thank everybody for being here. I especially want to thank Secretary Kennedy and his team for being here. This is so important. It involves rural health care, and everybody here knows the importance of rural Texas. And Secretary Kennedy, listen to the song.
Yeah, I'm sure we're okay with that.
All right, so everybody listen up. We have a minute to spare. There's this young man, it's about rural health. There's this young man, gets involved in an automobile accident, loses his left arm. He's feeling really bad about himself. Months later, he's walking down the street. He sees this judo studio, and he walks into the instructor and said, "Do you think a guy like me with no left arm could learn judo?" The instructor looked at him and said, "Yeah, I could teach you judo." So he starts teaching him this throw. And he goes for weeks and weeks and months, he keeps asking the instructor, "Don't I need to learn another throw?" We're not done yet. I'm almost done, guys. I'm almost done. So he teaches him the throw, and he says, "It's time for you to go to a tournament." And this young guy says, "Well, I only know one throw." He goes, "No, we're going to a tournament." So they go to this tournament. This fellow steps up on the mat. He's got his belt, his sleeve tucked into his belt. He wins the first match. He's shocked. It happens again and again and again. He's finally in the final, the grand championship. He gets out to this guy, and he beats this guy. He goes back to his instructor and said, "How in the world did that happen?" And the instructor said, "Well, there's three reasons. Number one, when you step up on that mat and you've got a sleeve tucked in your belt, as George W. Bush would say, they all misunderestimate you. Beyond that, your body has to work together to make sure this throw is executed properly. And the third thing is you've got a secret weapon." He said, "What's the secret weapon?" He goes, "The secret weapon is the only counter for the throw that I taught you is for somebody to grab your left arm." So this is rural Texas. Every time we come to Austin, everybody misunderestimates us. We all have to work together in rural Texas. We've got 161 counties that are not urban counties in the state. We all have to work together to get things done. And we have a secret weapon. The secret weapon for us is it's the rural areas of the state that produce the food, fiber, and fuel for the entire nation, not just the state of Texas. There you have it. That's rural health. It's all yours, Governor.
Ted, that's why you're going to be out of a job here. I think y'all know what I'm talking about, right? Well, listen, I want to thank once again Secretary Kennedy for joining with us here today. Different topic today than it was yesterday, but extraordinarily important. Also, I want to thank everybody who is behind me right now. They are professional representatives in the healthcare field, focusing on rural Texas. And they're just a small number of the many healthcare professionals in rural Texas that are so vitally important. Rural Texas is vital to our state. Texas wouldn't be Texas without rural Texas. And I do want to start this like I did in our meeting earlier, and that's by remembering a part of rural Texas that was just decimated last month, and that is in Kerr County, an area that we have representatives in today working on economic development to get the small businesses back up and running. But key thing healthcare in one of the darkest moments, one of the most challenging moments they ever had to deal with. But they did it very successfully. They did it because they were prepared to do so. Our goal has to be to ensure that every corner of our state is going to be prepared to respond to the healthcare needs of their community, however unique they are. The rural parts of the state represent the majority of the state, definitely geographically. More than 190 counties are categorized as rural in this state. In those more than 190 counties, we have more than 6 million Texans. Texans who have healthcare needs just like everybody else in the entire state of Texas. We have an obligation to ensure that those communities are going to be able to succeed, and an essential component of those communities being able to succeed is having access to health care. We had the opportunity before coming in here to talk about some of their needs, and actually talked about some of the ways that we have addressed this past session. Texas provided more than $300 million to address the needs of healthcare in rural Texas. Over the past 2 sessions, we provided almost $500 million to address mental health care needs in rural Texas. Both of those are pressing, and they require unique strategies to address those needs in the rural setting that's different than what you may find in Harris County or Dallas County. Very importantly, because of what President Trump and his administration did in the One Big Beautiful Bill, it provides $50 billion rural health care. Texas is going to get $100 million a year for 5 years, $500 million as let's say a guaranteed tranche, and then Texas will compete for parts of the remaining $25 billion. This money is truly going to transform what is going on in the delivery of health care in the rural settings. In Texas, we're going to focus that funding on women who are pregnant or recently gave birth, children, seniors, and uninsured Texans. But also we're going to be looking for the correct strategies that are seeking to achieve not only what's needed in rural Texas, but the strategies that are demanded by the administration for the funding. We covered some of those in our meeting earlier that I'll just recount some of them to you. One is to expand and improve the delivery of telehealth, especially behavioral telehealth, to the rural regions. This is so important and just makes sense, and now we have the capability with the advanced technology as well as artificial intelligence where you can be in one of the tiniest little towns in the state of Texas and have access to some of the best behavioral health doctors in the large medical centers in Houston or Dallas or elsewhere. Along those lines, there's other ways in which we can implement both technology as well as artificial intelligence to really accelerate and advance and improve the provision of health care in rural settings. An issue that's I will call a chronic issue for rural health care, and that is staffing. There's pay-based issues, attracting the appropriate medical providers, whether it be doctors, nurses, things like that. We will be using this money to work on staffing issues, but it has to be done in ways that will lead to permanent solutions that will be lasting and enduring past the expiration of the funding that's going to be provided here. And another thing talked about was doubling down on primary care in the rural setting, focusing on helping to ensure that those in rural settings will have the same access as those in the urban settings to be able to prevent getting ill or being subject to diseases that they need that care for. Someone who is leading this charge more so than anybody I've ever seen. It seems to be his life's work and his life's passion, and that is Secretary Kennedy. And you'll see when you hear him what his passion truly is for this. And because of his drive, because of his vision, he's helping the entire country to be healthier. country, incomplete as a healthy state, if we do not prioritize our rural communities. And so I want to thank Secretary Kennedy as well as President Trump for helping to prioritize the vast rural regions of our state to ensure that health care in those regions is going to improve. Thank you, Secretary Kennedy.
Thank you very much, Governor Abbott. I would add to that one of President Trump's primary passions are the rural areas of this country. These are the areas that he won overwhelmingly because he was communicating his understandings of their importance and their needs. And you just heard this very erudite description of how rural areas, particularly in Texas, provide the food, the fiber, the energy that we use throughout our country. President Trump also understands that there's a cultural importance to us preserving the rural areas of the country. This is the source of our values, our virtues, our character as a people who came from the small towns, from the rural areas. President Thomas Jefferson said that American democracy is rooted in the tens of thousands of independent freeholders who own the land, and without them, who have a stake in our economy, a stake in our system of government, a stake in our culture. And if we lose rural America, which we're in danger of losing right now, we'll lose part of our capacity to preserve and understand and appreciate the American soul and the American experience. Rural America is in crisis, and the rural hospitals are absolutely critical for them surviving these crises. These institutions are not just medical providers. They're, in most cases, they're the single largest employer in those areas. They have the highest paying jobs. And when they lose them, as we talked about before, it's not just the hospital that closes, it's the pharmacy that closes, it's the stores that close, and the community collapses. So we have to, and President Trump understands it, preserve these rural hospitals, and they were closing at an epidemic rate. And that's why he put in the big, beautiful bill, the Rural Transformation Program. And I'll talk just a little bit about what that will do. Right now, we send about 7%, 6 to 7% of Medicaid dollars to rural hospitals. And that's about a total of $19 billion a year. So they're already getting shortcut. It's a very, very small sliver of what Medicaid pays out goes to these institutions in rural areas. President Trump's big, beautiful bill is going to give $50 billion over 5 years. So that's an infusion of $10 billion a year. That's an over 50% rise in the amount of federal dollars that is now flowing into rural areas. This bill has the capacity to save these rural hospitals, to give them a chance to stabilize themselves, to right the ship, and then to adopt innovation and workforce changes so that they can survive for the decades into the future. The money, as Governor Abbott pointed out, the first $25 billion of that is going to be distributed evenly to the 50 states. The second $25 billion is going to be distributed based upon a number of metrics, but particularly the quality of the applications. We want to see money spent on infrastructure. We want to see it spent particularly on innovation, adopting telehealth and AI in rural communities. We want to see it spent on workforce quality and quantity improvement, which is another staffing crisis that rural hospitals face. And we want it spent on, we want to see proposals that will emphasize holistic care, preventative care, value-based care, and physical health, exercise, food, these kind of things, and rebuilding the infrastructure of these facilities so that they can last for generations. The applications are coming out, the deadline is coming very, very quickly. And so we met with the rural health providers today, and we encouraged them to cooperate. We didn't really have to encourage them because they already have extraordinary cooperative relationships with each other. They came up during our meeting with a series of ideas that every one of them, from a personal point of view, I wanted to fund. As they're the kind of ideas that could propagate and spread, and that were very, very thoughtfully crafted, and we'd like to see those kind of things adopted throughout the country. I think you have an extraordinary quality of leadership in these rural health care in this state. And I'm very confident that the application is going to be a stellar one. One of the things that I talked about with Governor Abbott is that part of the score is going to be how well the state has done at adopting kind of the MAHA legislation. And Texas now leads the country, so I think they're going to do very, very well in their application. The decisions will be made by December 1st. We will evaluate all the applications, and then the money will be distributed starting in January. And so I've encouraged Governor Abbott and these wonderful leaders behind me to work as hard as they can to come up with the most innovative solutions. I want to say one other thing that is going to benefit rural hospitals in this country. President Trump has signed an executive order that requires when we at HHS or the other federal agencies want to adopt a new regulation, we first have to get rid of 10 existing regulations. And the rural hospitals are very, very badly overregulated, and it's one of the reasons they have very high costs. We've encouraged the people in this room to provide us regulations that are impediments to them providing good care to their patients, and we will do everything we can to get rid of those regulations, to untie their hands, to allow innovation to flourish, to turn every county in Texas into a laboratory for healthcare innovation. And let's get in the AI and the telehealth and all of these entrepreneurial changes that we can have when you have such a brilliant, thoughtful, and imaginative leadership in the state. Thank you.
Thank you very much. We'll take a few questions.
Secretary Kennedy, thank you for being here. How can you ensure that the CDC can continue to operate effectively in light of these recent resignations?
So if I could just say one thing, I know he'll have to answer that in a second, that we can stay on topic first. Thank you for not wasting any time getting off topic. Let's. We're going to come back to you.
Governor, right here, I have a question for both you and the Secretary. What do you say, you're talking about a December 1st deadline, what do you say to the pregnant woman in Fayette County right now, or the cancer patient in Llano County right now, about keeping their health care options available to them?
Well, I think the big beautiful bill, the money, that's why we want to get money out the door as quickly as possible. This is an unprecedented fast pace. And the reason that we're addressing this with such rapidity, which puts a huge burden on my agency and the federal government to make these decisions, is because we understand the dire need that people in rural areas are now suffering, and we want to get them that money as quickly as we can.
Also, in the legislation that we signed in the regular session, there was about $300 million that went to address healthcare needs like that in rural regions in the state of Texas.
Secretary Kennedy.
I have a question for you. So you talked about telehealth being a solution for families in rural communities, but as you know, many areas in Texas are designated behavioral health workforce shortage areas. And so while you're saying telehealth is a solution, if you don't have the staffing across the state to address the needs of families, where do we go from there? How are we going to address the staffing issues to make sure that families in crisis can connect with someone even through telehealth? And is there a plan in place to sustain the 988 crisis lifeline so that people can have a direct source of support? I'm a journalist and a psychotherapist, so it's important to me to know that that resource follows all the way through to a person in need.
Sure. So we can both try that. So for one, you're mentioning a couple of things. One is the availability of telehealth. We realize that's possible in some ways, not possible in other ways. We've got to find ways to expand that. Staffing is another crisis point issue that we're working to address, whether it be on mental health related issues or non-mental health based issues. But it's, through the telehealth, that's one way in which we can actually expand access to staffing without them being there in person, but through the telehealth approach.
Two more questions.
Secretary Kennedy, that's Karen Hall with CBS News. Thanks for being with us today. My question is, in speaking of rural Texas, we know places like Uvalde have experienced one of the worst mass shootings in history. The CDC has previously been responsible for studying gun violence. A lot of those programs have been cut now. Would you still consider gun violence a public health crisis? And who's going to be addressing it now?
I certainly consider mass shootings a health crisis, and we are doing for the first time real studies to find out what the etiology of that is. And we're looking for the first time at psychiatric drugs. You know, these kind of mass shooting, people have had guns in this country forever. When I was a kid, we had shooting clubs at our school. People, kids, my classmates, and other people would bring a .22 rifle with their guns to school and park it in the parking lot. Nobody was shooting. So there's never been a time in America, in the history of humanity, and people walked into a crowd, into a church or a movie theater or a school or a crowd of strangers that just started randomly shooting. It's happening in our country. It's not happening around the world. And there are many other countries that have comparable levels of guns that we have in this country. We had comparable levels in the 40s, 50s, and 60s, and people weren't doing that. Something changed, and it dramatically changed human behavior. And one of the culprits we need to examine is whether the fact that we are the most over-medicated nation in the world, and that a lot of those are psychiatric drugs that have black box warnings on them, that warn of suicidal and homicidal ideation. So we are doing those studies right now for the first time, and we will have an answer.
National Research Project Agency
About the
for Health.
CDC, about the
Hold on a second. He opened with that. He gets to go back to it.
Thank you, Governor. My question was, in light of the recent resignations at the CDC, how are you ensuring that that agency is able to do its job effectively?
I would say this, that first of all, I will confirm that we let go Susan Menarez yesterday. I'm not going to talk about personnel issues, but you know, the CDC is an agency that is very troubled for a very long time, and anybody who lived through the COVID pandemic and saw all of these bizarre recommendations that were not science-based, all the misinformation, understands that the CDC has on its website today that among the top 10 medical innovations, greatest medical accomplishments in history was abortion. This is one of the greatest medical accomplishments because it keeps small families. Go to the website, look at it. Fluoridation, giving kids a toxin, and vaccines. So there's a lot of trouble at CDC, and it's going to require getting rid of some people over the long term in order for us to change the institutional culture and bring back pride and self-esteem and make that agency the stellar agency that it's always been. I'm very confident in the political staff that we have down there now that they're going to be able to accomplish that and ensure the competent functionality of that agency.
That's it. That's all we got time for. That's all we got time for. No, that's all we got time for. Thank you. Thank you, guys.